So good afternoon, everyone. Thank you for joining us for today's webinar with NAMI Greater Cleveland on TMS, Transcranial Magnetic Stimulation. Very happy to be joined by Dr. Jeffrey Turell from Strive to provide us with this presentation. Just a few notes to be aware of before we get started. This is being recorded and will be posted to the NAMI Greater Cleveland YouTube channel later this week. We will also provide these slides to you in a follow-up email after the presentation. I will also be asking you to complete a brief anonymous survey evaluating this program, and we appreciate your honest feedback, so we do hope you will complete that. A few words about our organization, NAMI Greater Cleveland. NAMI is part of the National Alliance on Mental Illness. Our mission is dedicated to improving quality of life for individuals with mental illness and their family members. We do that by providing information and referral, education, support, and advocacy. Please do remain muted during the presentation so that we can limit background noise. I will be monitoring the chat feature while Dr. Turell is presenting. We are asking, however, that you would hold any questions you have until the end. We will allocate around 10 minutes before we wrap up for questions, as we imagine many of you attending this webinar have personal interest in learning more about possible options for receiving TMS treatment. So we'll make sure that we address some of those questions and other questions as we wrap up. So with that being said, I think I will hand it over to Dr. Turell to introduce himself and get us started on this presentation. Thank you all for joining us.
Thank you, Matt, for inviting me to speak today about TMS treatment, short for transcranial magnetic stimulation. My name is Jeff Turell. I'm a founder of Strive Mental Health and Wellness based in Shaker Heights, where we've been since 2018, and started TMS since the beginning because I thought it's an important component of treatment for people. So without further ado, we'll start with the presentation. We'll start with a couple questions. First, I'd just like to get a general sense. How many of you know someone with depression, either a friend, family member, or could be yourself?
Yeah, so feel free to put your response in the chat or raise your hand using that feature to let us know if you know someone with depression. Seeing some hands going up here. Yep, 4 people so far. Looks like so far 6 folks. 10 folks. Yeah, so most of us on this call.
Okay. And how many of you know someone who's tried one antidepressant, maybe one antidepressant after another, but is still feeling depressed, still suffering from depression, even though they're on an antidepressant?
Yeah, looks like we've got quite a few more. Again, looks like about 10 folks have responded yes so far.
So, you know, that's what we refer to as treatment-resistant depression. It's that you're receiving a treatment for antidepressant for your depression. It's just not working effectively. And of the people who have been treated, or someone that you know who's been treated, how many of you know someone who's experienced a side effect from taking an antidepressant?
Yep. Many side effects, folks are saying. We've got like 8, 9, 10
And
folks.
you know, side effects can include feeling tired all the time, or putting on weight since you started the treatment, or having sexual side effects or sexual dysfunction after starting the medication. Those are some common ones, or severe nausea, vomiting, or stomach upset. So seems like a pretty good amount. So basically any of those can be reasons for starting TMS. So I want to start with a case just to put like a face on it. So this is the case of Mr. Active Duty. He's based on actual case, but not exact, so that it's protects the identity of the person. This is a 27-year-old male serving in the U.S. Navy who lives in Greater Cleveland. His depression got worse over the past 2 years. He had tried multiple medications, and they were not successful or caused him side effects. He went to an IOP and then to a residential treatment program, but despite that, he remained depressed. He came to Strive for evaluation for treatment with TMS. He was found to meet the criteria, and so we started him on a course of TMS treatment. Through measurements with the clinical rating scale, the HAM-D, the Hamilton D depression scale, and by his own report, the treatment with TMS obliterated his depression from a very severe depression rating to none at all. He continued through his request for medical discharge from the military and has started a new chapter in his life. So you may be wondering, what exactly is TMS? Does stand for transcranial magnetic stimulation. And this is a mouthful, but hear me out. It utilizes the principle of rapid electrical discharge released by capacitors, which are in the machine in the back. It generates through that electrical discharge a pulsed magnetic field created when current passes through two copper coils that are next to each other in this plastic casing placed on the patient's scalp. There's a little plastic device that kind of looks like an old school telephone receiver that has the coils on the inside of that. And then that magnetic field stimulates the neurons in the area of the brain known as the left dorsolateral prefrontal cortex, which results in neuroexcitation, releasing the neurotransmitters or neurochemicals, and that itself becomes the antidepressant, results in the antidepressant effect. So we're going to break that down bit by bit. So anyone remembers Back to the Future, where they referenced the flux capacitor? It was releasing a lot of energy, but theirs was powered by plutonium. And in TMS, our electricity is released rapidly, but by electricity from an outlet. What it does is generates a magnetic field, kind of like how Magneto could do just his powers that X-Men referenced, but in a similar way, the electrical current generates the magnetic field when the current passes between the two loops of copper coils in the device, and that magnetic stimulation, magnetic field stimulates the brain and causes brain stimulation. The use of magnets in medicine has been known throughout the history of time, just in different levels of sophistication. Ancient civilizations in ancient Egypt, India, China, and Greece were aware of the benefits of magnetism, but they didn't understand the scientific basis of exactly why it was happening. In the European scientific Enlightenment period around the 1800s, there was greater scientific understanding of electromagnetism, but it wasn't linked to treatment of a specific condition. And then in the modern era, MRI was first used as a diagnostic device using the power of magnet waves to produce an image starting in 1977. And then as a therapeutic potential through transcranial magnetic stimulation, since the potential for it was identified in 1985. It was approved as a treatment for depression that had not responded to medications in 2008. So that from the 1800s to about the current, to the demonstration that it was that magnetism could be applied to the human body took about 100 years. So Faraday in 1881 found that he could pulse an electric current between a copper coil to generate a magnetic field. And then it was an experiment by Barker in 1985 that was able to demonstrate transcranial magnetic stimulation in a human, causing current in the human brain that caused a hand twitch of the thumb when applied to the when the impulse was directed to the motor cortex, because when the left side is stimulated, the right side as a thumb twitch. They developed the figure 8 coil a few years later, and by 1995, there was a proof of principle that using TMS could treat depression, so that there's this mental health benefit of TMS. With a study to show that the NeuroStar TMS system, which is a manufacturer of TMS, was effective in treating depression. And then it was approved by the FDA in 2008. So the first time anyone could get treatment for depression with TMS was 2008. So we're talking about the past 16 years. And in medical terms, that's still a pretty recent development. Most recently, 10 years after that, just about 5-6 years ago, the FDA approved a different protocol called Express TMS, which is a 3-minute protocol using a different wave pattern called theta burst stimulation, and found it to be equivalent, or what they call non-inferior, so didn't do any worse in outcomes, giving 3 minutes of the theta burst compared to a 39 minutes of stimulation of the standard protocol for treating depression, which basically allowed for being able to have a shorter time of treatment for each treatment session. So what is happening in depression, and how does it affect the brain? What we've been able to determine from PET scans is that when a brain is not depressed, it's very active, and it is using lots of glucose and oxygen, and those are things that could be measured by imaging devices that look at the brain's physiology. But in a depressed brain, the brain is very underactive. It's not lighting up as much. It's not using as much oxygen or glucose, so it's not having as much activity. And then when TMS is offered and directed to the brain, what happens? We can see on the depressed side, underactive type looking brain, and after the TMS, where there's been this stimulation of the magnet waves causing the brain to fire its neurons and release its neurochemicals, causes a lot of activity in the brain, which is then starts to use glucose and more oxygen and be more active, and improving both function and emotional improvement. So, so what is TMS used for anyway? So TMS, at least for on the mental health end, is FDA cleared to treat major depressive disorder that's failed at least one course of treatment with antidepressant. There have been some additional uses that have been developed on specific TMS devices, including obsessive treatment for obsessive compulsive disorder, as well as smoking cessation. And then there are TMS is useful in the brain if you can understand the condition that you're trying to treat, where the area of the brain the problem is related to for the condition, and whether it would be helpful to stimulate or inhibit the brain during that situation. So there are other conditions such as anxiety, post-traumatic stress disorder, ADHD, dementia, different substance use disorders, bipolar, and schizophrenia that have been studied with promising treatments for those conditions with TMS. But those are currently under investigation and not FDA approved. So why offer TMS? Well, according to the SAMHSA, that had put out a survey that there's over 17 million adults in the US, or about 7% of the population, who suffered from major depressive disorder in the past year, at a cost of over $200 billion in direct and indirect costs. And over a lifetime, depression is affecting about 15% of the adult population, or about over 34 million people. Depression is the leading cause of disability in America and in the world. And what we find with treatments with medication is that each time a medication is used, if it's found not to be helpful, the next medication tried is less and less helpful or effective with each subsequent medication trial or treatment failure. Also, there's the matter of suicide, which is associated with depression in 2/3 of the cases. And what we see is that oftentimes with TMS, that even though the FDA has approved TMS treatment after only one failed medication treatment trial, that insurance companies oftentimes will require the failure of 2 to 4 medication trials or classes before authorizing TMS. So they're requiring you to try multiple medications, and each time you try one, the likelihood of it helping you is less and less, goes down and down. So where does TMS fall in the effectiveness compared to other treatments such as medication and ECT, which is still being used? So I like to call it the Goldilocks effect. TMS sits somewhere in the middle between medication and ECT. So for example, medication can have a response rate in the range of 40 to 60%, but it comes with side effects of um, can cause palpitations, somnolence, stomach upset, weight gain, sexual side effects. It causes remission in 27 to 45% of the time, but that amount declines each time there's a treatment failure. It's less and less effective. There's a greater likelihood of having to discontinue treatment each time there's another medication trial. And once the medication is used to treat the depression, even when it's effective, recurrence rates could be up to a third of the patients being treated. ECT, on the other hand, has an excellent response rate, 80%, but it requires you to go into the hospital, receive anesthesia. You require someone else to drive you to and from, and you're not able to work at all that day. Side effects of ECT include memory loss. You can become delirious related to the effect of the anesthesia. You could have an allergic reaction to anesthesia or respiratory complication. Plus, there's the historical fear and stigma of ECT. TMS falls somewhere in the middle with a response rate of 60% of the patients noticing some improvement, with remission in 33 to 37%, close to 40% remission. When I mean remission, it means the depression is completely absent, no longer there anymore. And the good part about TMS is that it doesn't have the side effects of either the medication or the ECT. I just want to take a brief detour. This is Mental Health Month, and I wanted to talk about stigma in mental illness, and sometimes people not wanting to seek help because they feel they're not they'll be thought of differently if they have a mental illness, or that it's could be considered a sign of weakness, or that they somehow weren't able to pull themselves together, and so they avoid letting people know that they have a condition. They suffer in silence, or they don't seek treatment. So here's just a case. A 47-year-old male who has ADHD, which the symptoms were from childhood, with difficulties finishing a test, but the structure of home was helped. School performance difficulties continued into high school with deadlines, and then also into college, but could overcome those by pulling all-nighters. Was able to do what worked for him and got good grades, along with the structure of school and a supportive environment. But during residency, got into difficulties with completing tasks on time, and was only realized and was diagnosed with ADHD at the age of 32, after having troubles and unable to get promoted in the first residency program. And treatments were started for ADHD, which helped in a second residency program to get through the intern year, but still experienced troubles in the second year and wasn't promoted for that residency. So this person had a strong belief that they could, that they had the inherent abilities to be successful if they could just be given the opportunity. So this person never stopped believing in himself. So how did things turn out? This person applied for their New York medical license and their Ohio medical license and got that, and just started working very soon after getting their medical license, and then took on another job, and then was able to just consolidate into one job, but still had troubles with workflow, especially on a busy day, and decided to open up a medical practice to be more satisfied with work, and still has a practice and works as an independent contractor, and is practicing medicine now for several years, and has never been fired or no lawsuits, and enjoying a life and career and family. So how do I know? It's because that's me. And this is something that I dealt with and didn't know that I had it, and was able to get the help that I need to overcome it. And I'm not afraid to share it. So I want to continue on with the presentation. So what are the known benefits of TMS? TMS is what's good about it is that it's a locally directed treatment that directly stimulates the brain. So there's no side effects such as with medications, which have to go throughout the whole body before they reach the brain, and can have side effects anywhere in the body before they get to the brain. There's no anesthesia required. There's no hospitalization required. You can drive to and from the treatment session. You can go back to work as soon as you walk out the door, same day. There's no worsening effect on memory. In fact, it's being studied as a treatment for dementia, so it actually can help memory, not make it worse. And then with the active treatment time of the theta burst protocol being 30 minutes and a session lasting anywhere in the range from like 11 to 20 minutes, a patient could be back to work in an hour, including treatment time and commute time to and from work. TMS is also cost effective compared to other treatments and improves quality of life. TMS was found to be more cost effective than medication. And you may ask why. Well, up to 40% of patients with depression either don't respond or do not tolerate medication, and up to 85% who do respond can have a relapse. And when they do, medication is less effective with each trial. And if those depressive episodes related to ineffective medication trials result in hospitalization, that also has a high cost, which is factored in. If you look at ECT, which is a very effective treatment, the cost is very expensive because it's done only in the hospital and it requires an anesthesiologist and a psychiatrist. And the cost of 10 sessions can cost $25,000. TMS is somewhere in the middle with a range of a treatment from $250 to $500 per session. Could cost for a full course of treatment $7,500 to $15,000. So you can see quite a bit less than the ECT. So what does a typical course of TMS look like? Well, first it has to get approved and to see if treatment is right for you. And that's done with an initial screening consultation and prior authorization, including a baseline Hamilton D depression rating scale. Then they undergo a mapping session to find the motor hotspot. That's that area where you find where the area of the brain that makes the thumb on the other side twitch. Then you know you're in the right spot. And then they find the motor threshold, which is the lowest amount of stimulation that can still cause the thumb to twitch. Because you want to use as low of an amount of stimulation as is effective. There's given 36 total sessions with 30 standard treatment sessions Monday through Friday for 6 weeks. And then there's usually given 6 taper sessions over a period of 3 weeks, which could have like 3 the first week, 2 the second, and 1 the final week, just to ease you back off of the treatment. Then periodically, there would be a motor threshold redetermination and checking the Hamilton D for symptoms of improvement of the depression. There have been studies to show that even when there's no response by the 4th week of treatment, still an additional 20% of the people who had not responded yet will respond by finishing 6 weeks of treatment. So it is worthwhile to continue treatment even if it's been a month and you haven't had a response. So what does a standard typical TMS session look like? We'll start with a brief symptom check-in, how you're doing for the day. There's a cap that goes on each person's head that kind of looks like a swim cap, but it's like a fabric based. And you put in earplugs, both the patient and provider are provided with earplugs. We do a measurement to make sure that the distance is where the cap is where it's supposed to be. And then we've set the parameters for the session, the intensity that the machine is going to deliver, and the duration. And then we line up the device to the treatment point, which is 5 to 6 centimeters forward from the motor hotspot that had been previously identified. And then we start the treatment, which could be as short as 3 minutes of active treatment time. In a real world setting, that means a 3-minute simulation has a total treatment session lasting anywhere in the range of like 11 to 20 minutes, depending on the session. And then we just schedule the treatment for the next session. And some people, when they hear, well, there's going to be like an electrical capacitor, an electrical current, some people start to be like nervous about it or what it's going to feel like. So we try to just make a relaxing environment. We'll use nature sounds such as a waterfall. We'll have like jazz music in the background. Give someone, we have a whole wall of options for like a fresh brewed cup of tea, and we have herbal tea options. We use a vaporizer for giving a calming lavender scent. We, during the treatment, give a deep breathing practice with focus on gratitude. And if you're interested in laughter or having something to help boost your mood during the session, we have the whole complete Seinfeld series available. So there's, situations where you wouldn't use TMS. TMS is not for everyone. If someone has epilepsy, then we wouldn't be giving TMS because it would cause too much stimulation for them. Because it's going to have a magnetic response, there's metal in the head or neck region, either from a foreign body or a surgical hardware or a medical, and we wouldn't be able to do TMS. But if it's a dental wear, then that would be okay. If someone's pregnant, we don't do TMS during pregnancy. If they have a neurostimulator or a medical infusion device or a cochlear implant for the ear, we don't do TMS. Or if they have a implanted medical device or a pacemaker, we don't use the TMS. We don't want it interfering with the device, the function of that device. You might be wondering, well, the side effects to all the treatments for depression, the side effects of TMS. And they're mostly local. Some people report having a headache after the treatment due to the contraction of muscles that are in the scalp. And some people notice a pain in their neck due to the contraction of neck muscles. Some people notice a irritation of the scalp at the application site. Although it's pretty rare because the device is shielded and has a cooling fan, and you're using the protective head cover. But those local symptoms could be managed with low-dose ibuprofen. Some of the other potential complications are hearing loss due to the sound of the machine, but that's completely preventable by use of earplugs, which are mandatory at each session for both the patient and provider. And the most serious but rare would be triggering a seizure, but that happens about in like 1 in 1,000, which is even less than the risks of some other antidepressants or psychiatric medications. We would avoid patients who have epilepsy from giving them the treatment. We would encourage sleep hygiene and reducing caffeine, because having a good amount of sleep and reducing other sources of stimulation such as caffeine can reduce the likelihood of a seizure. And then we can, when we are reassessing motor thresholds, we're making sure that we're using the lowest level of stimulation that provides the response. And of course, we have protocols if there were a seizure, although there's never been an in-office seizure at Strive. Strive is currently accepting new patients, and we have openings for TMS. We also have residential TMS, which I'll speak to in a moment. We also have free consultations along with initial psychiatric evaluations. So residential TMS is one of the programs offered at Strive, where we're offering TMS to people who may live too far away to commute daily every day for 6 weeks. And usually if someone's having to drive more than 45 minutes each way, we would offer them the residential TMS, where they're able to stay upstairs from the office. There's like apartments upstairs. They could stay there during the time of the treatment. They'd be offered a RTA pass and a MAP, as a pass to participate in any of the Strive Wellness Hour fitness activities that are going on, and a list of activities and events going on in Cleveland. It's available for one person at a time. And some people who could use that or be good candidates would be someone who's possibly in the military, who gets approved by their base or has medical leave and insurance authorization, or anyone with Medicare or Medicaid in Ohio that could be across the state, that's from out of town or across town, or anyone who's self-pay who just wants to get away from their current environment and get a fresh start, Shaker Heights is a nice place to be. We've got a library right across the street and a grocery store right behind us. So, and the RTA is right at the corner. So with the Rapid, so it's a pretty convenient kind of place. Talking about coverage and payment options, it's TMS is covered by Medicaid, and we currently are accepting CareSource, Buckeye, Humana Health, and AmeriHealth. Just one moment. We also accept Medicare and TRICARE, as well as Humana, as along with any commercial plan who offers out-of-network benefits. Anyone who has a flexible spending account or a health savings account is able to use that for payment. And then there is a 0% financing for people who are self-paying, and self-pay options to pay like on a daily basis, a weekly basis, or they could spread out their payments over time if they need to over a 12-month period. Some of the things that we're looking to add to Strive is mobile TMS, where we would offer TMS to people unable to travel for their care, whereby we plan to customize the van with a TMS machine inside and bring the van either to nursing home or residential treatment centers, military base, or community mental health centers, going to one facility at a time, providing people who are good candidates and receive the prior authorization a 6-week course of TMS treatment. And when treatment is complete, we would go to another facility. Currently, we're reaching out to other facilities to see if they are wanting to be part of our mobile TMS service. What you can do to schedule a consultation is call our office. The number's here, 216-752-9090. We're located in Shaker Heights on Lee Road. And we have the main strive4today.com with the number 4. And we also have a TMS specific website, strivetmscenter.com. And if you have any questions, you can contact me by secure email at drjeff@strive4today.com. And at this time, I'd like to open it up for any questions.
All right, thank you so much, Dr. Turell. So if we have any questions, feel free to include them in the chat. So now is your time. Also going to put in the chat the link to the survey for this presentation. If you can complete that evaluation for us, we do appreciate that honest feedback. A couple questions here are, can people with autism be considered for TMS?
So, well, there are treatments that have been investigated for autism, use of TMS for treating autism. It is not currently a covered condition. However, as is often the case with mental illness, there are often comorbid conditions. So let's say that a person who has autism is also suffering from depression, well, then certainly they would be able to receive treatment with TMS.
So autism is not one of those conditions that would disqualify someone from receiving TMS, like epilepsy, for example.
No.
Okay. Another question we had is how prevalent is what is the availability of TMS across the United States currently?
So, it is available throughout the country, but it's not many places or practices don't offer it. And there's a couple of reasons for that. One is that to set up a machine in the office is quite expensive. It can range anywhere up to like $70,000. So whether it's an agency or a practice, they may not be willing to invest in the machine. But that's only one part of the equation. The other part is who's going to run it. And so not only do you have to have the machine, but someone who is trained and familiar with a good understanding of how to operate the machine and the principles behind it. So for that case, for myself, I went to a training program at Harvard University for they had a week-long training of TMS for physicians. And I was able to get the training and certification and set up a way to like purchase a machine through a vendor. So not only do I have the machine, but also the training on how to use it, and there's that's often not able to come across for most offices or practices.
Thank you. And another question here, any plans on expansion to other parts of Cuyahoga County or beyond? I think we might have lost Dr. Turell. I think he was having internet issues. Let me see. Yep, we lost him. Sorry, everyone. It's just me now. Let's give it a minute to see if he's able to rejoin, but otherwise, I did put the link in the chat to the survey once more. Click on that link before we wrap up. I'll also put the link in the chat to Dr. Turell's practice. So we have that. And we will also be sending you the slides so that you can view this information at a later date. Here he is again.
My
You're
apologies for that. I'm not sure what happened. Somehow we just got disconnected, but
It happens. I did put the link to Strive's website in the chat, Dr. Turell, and also one final question that we did get was, do you have any plans of expanding to the west side or beyond, or anywhere else in Cuyahoga County and beyond? What are any future aspirations for Strive and for TMS?
so I've been very much interested in opening, exploring expansion to the west side. When trying to find a community similar to Shaker Heights, immediately comes to mind
That's what I
Lakewood,
thought. Yeah, Lakewood.
Ohio City, or Tremont.
Hmm.
Um, and so we've been looking at those options, but first we're just trying to get people to our Shaker Heights, when we're full and at capacity, especially with the TMS services, then we will be looking to expand, and it will most likely be to the west side.
Right. And then there's also like your slides mentioned, the mobile TMS
Yeah.
program. So
Mhm.
that would be addressing some of that as well. So,
Yeah.
all right. I'm not seeing any other questions. So I think we can wrap up. Oh, just some gratitude in the comments from folks. Thank you, Dr. Turell. Thank you, Nami. We appreciate your words of thanks, Deanna. So thank you for saying that. Again, this is recorded, will be posted later on our YouTube channel. Thank you again, Dr. Turell, and I'll make sure everyone gets this information in a follow-up email.
Absolutely. And yeah, so just to, if anyone would like to meet, schedule a session or a consultation, they can reach out to my office, or they can go online to strive4today.com. That's the number 4. And they can schedule a an appointment.
I will include that information in the email I send to all of our
Okay,
attendees as well.
great.
All
Okay.
right, everyone, have a great day.
Okay. All right. Bye-bye. Thank you.